All right, good afternoon, everyone. I'd like to welcome all members and guests to the March 7th, 2023 Board of Health meeting. I'd also like to remind you that our meetings are web streamed and televised and ask you to ensure your phones are on silent mode. If you're attending virtually, please mute yourself when not speaking. For staff in attendance virtually, please use the Microsoft Teams hand raise feature icon to be called upon and remove it after finished speaking. Please turn on your camera and be sure to unmute yourself. With that, I call the March 7th, 2023 Board of Health meeting to order, and I'm looking for a motion to approve the agenda as presented. Moved by Board Member Michelle, seconded by Board Member Vanendry. All those in favor? That's carried. Are there any disclosures of pecuniary interest? I myself am just a reminder that I did declare and I will declare again conflict of possible pecuniary interest on the February 7th or 27th, 2023 special Board of Health meeting in relation to the closed session matter. So when we get to that section of the minutes, I'll pass the chair over to Board Member Michelle. We have no consent items. We have no early closed items. We have no deputations and we have no presentations. So with that, we are moving along to 8.1. Oh, I'm going to pass the chair over. Councillor Michelle, we're looking to approve special Board of Health meeting minutes open and closed from February 27th and the Board of Health meeting minutes open and closed from February 7th. With that, I pass the chair.
Thank you, Madam Board Chair. We have those two items before us. Does anybody wish to pull any item from?
Sorry, Board Member Michelle. Deputy Clerk, the comment.
I believe you just declared a conflict on the 27th, so you can vote on the 7th, correct?
Correct.
So we'll do those two separate.
Yes, so I would need a motion to accept the meeting minutes of the Special Board of Health on February 27th. And it's made by Councillor Dawson, seconded by Board Member Duffy. In discussion, okay, all those in favor? It's carried, thank you. And the Board of Health minutes for February 7th, 2023, item 8.2. I have a mover to accept those minutes as information. Board Member Hopkins, thank you. The secondary Board Member Columbus. Debate, discussion. All those in favor? Thank you very much. That is carried. Madam Board Chair, I believe I can allow you to resume the chair.
Thank you very much. I appreciate that. We're on number 9, communications. We have the following communication item before us today. 9.1, January 2023 Alpha Info break. And Ms. Van Dyke, do you have any comments you want to share with us on that?
Thank you, Madam Chair, through you to the board members. This is the monthly information communication that comes from the Provincial Public Health Association. So it is here for your information.
Excellent. Any comments from the board? All right, mover to receive this information. Board Member Vanendry, seconded by Board Member Duffy. All those in favor? Carried. Staff reports, 10.1 information memo 2022-2023 ISPA suspensions. Ms. Van Dyke, I think you're ready.
Thank you, Madam Chair. We have Mr. Syed Shah here in person today, our Acting Director of Public Health, and Mr. Eric Robertson, who is attending virtually. Mr. Robertson is the Program Manager of the Vaccine Preventable Disease Team with the Health Unit, and he will be presenting this report.
Thanks, Madam Chair. Through you to the board members. Yearly, the Vaccine Preventable Diseases team at the Health Unit ensures that the Board of Health fulfills their mandate to the Ontario Public Health Standards by undertaking an enforcement of the Immunization of School Pupils Act, otherwise known as ISPA. Immunization, as we know it, is recognized as one of the most effective public health interventions of modern time. High levels of vaccine coverage rates for vaccines maintain low levels of vaccine preventable diseases in the community. ISPA was enacted to increase levels of prevention among the school-age children in the community against certain vaccine preventable diseases. In late January 2023, the Vaccine Preventable Diseases Program assessed the records of 1,279 students in the 2005 and 2015 birth cohorts. To date, we have removed 627 of these individuals from our initial list, which results in a decrease of 49% over the past month. Our suspension date is planned for May 3rd, 2023. We have a little bit of time ahead of us here, and we hope to see further decreases to that suspension list. In January, those 1,279 students were sent a letter in the mail to provide notification that their records were not up to date in our provincial database, Panorama. This letter requested that they update the records or make an appointment with the health unit or family practitioner to get caught up on missed immunizations. To help with this effort, we have increased the number of our health unit clinics we operate on a monthly basis. We've added weekly walk-in clinics during the month of March at the health unit. In addition, we developed a targeted approach for the 2005 birth cohort, where we were actively in the high schools. The team is currently out there doing this over last week and this week. We advertised all of these updated interventions through our social channels, websites, the mailouts, and through our family physicians. At the end of March 2023, we will be sending out a second notice to those who remain on the list. This will serve as a suspension order. The student will have until May 2nd to update their records. Those failing to do so will be suspended commencing May 3rd for up to 20 school days. The suspension will be rescinded once the record is up to date and the student can then return to class. With that, I'm happy to answer any questions the board may have.
Thanks very much. Questions from board member Clevis?
Yes, question. Some of the counselors perhaps have experienced this where a parent will ask for an exemption to be signed off on. Can you cover off some of that with respect to what this exemption is about? Should we be endorsing exemptions of people?
Yeah, through the chair to the member. Exemptions are available. There's a few different types of exemptions that can be done for the individual. One being a medical exemption, so that would be signed off by a physician. The other one would be a philosophical or a religious exemption, and that also needs to be commissioned by commissioners of oath. So like a county clerk or lawyer or somebody like that. Information on those is available through the health unit's website on the forms that need to be filled out. There's also an education piece, an educational video that needs to be watched, and then the individual has to declare that they've watched it in front of the commissioner. So there's those items. It's something that is available for them under the Act. But we do encourage individuals to contact our Vaccine Preventable Diseases team to see if there's other solutions available for them. We're certainly willing to work with people. The pandemic has caused numerous problems, as we're all aware of, with the lack of reporting or lack of access to vaccines. So we are willing to work with people and come up with solutions that our hope is to keep kids in school. But ultimately, we also need those records up to date to protect the school community.
Thank you for clarifying that.
You're welcome.
Any other questions from board members? Board member Huffman.
Thank you, Chair Martin. My question, when you talked about the commissioners in terms of signing off on I can't think of the word I want. Exemption. Thank you very much. It just left my head. As Norfolk County councillors, do we not have that office in terms of a commissioner stamp?
I'm not as familiar through the chair to the member. I'm not as familiar with who the commissioners are or who commissioners or both are. I'm sure that's maybe something our clerk could speak to, or
Okay.
but I apologize. I'm not as familiar.
Okay, because what my question is that I'm just wondering, as Board of Health members as well, it probably wouldn't be in our best interest to sign off on an objection exemption form. Those are just my thoughts. If we wanted to have any further discussion about that, maybe Tracy can clarify some more for me.
Sure, thank you through the chair. This is a service that Service Norfolk provides on behalf of the clerk's office, as they are commissioners for that. And I do agree. I would think that maybe it might be perceived as a conflict if board members were to sign off on those, considering that it is a service that we do provide.
That's a great point, Board Member Huffman. And I think also, as Board of Health or as council members, you don't just carry it because you're elected. You have to opt in, go and get the, I don't know, it's training, but get the information in the packaging. So we don't just have it. We have to opt in. Select it. Any further questions? I have one. I'm just wondering how the uptake is on the walk-in clinics versus the school visits. Is that a meaningful endeavor for the health unit?
Yeah, through the chair. Great question. Our walk-in clinics are actually starting next week for the following 3 weeks for the month of March. So we're unsure how they're going to be received yet. Our hope is that they're received well. Our current status is that we do booked appointments at our monthly health unit clinics. We have increased the number of clinics that we're offering, and the uptake has been beyond impressive for those clinics. So our hope is the walk-ins are the same.
Okay, that's great. Thanks. With that, I'm looking for a mover and a seconder to propose staff recommendation or an alternative. Moved by Board Member Huffman, seconded by Board Member Vanden Driesche. All those in favor? Carried. Thank you. 10.2, Alvin Norfolk Opioid Surveillance System, HSS 23005, Ms. Van Dyke.
Yes, thank you, Madam Chair. Ms. Kike Avinsleri, are the Program Manager of School Health and Substance Use, and Ms. Faiza Siddiqui, Health Promoter, are both online. And Ms. Siddiqui is going to present this report.
Good afternoon, Madam Chair and members of the board. I'd like to introduce Ms. Faiza Siddiqui, who is a health promoter with the health unit, and she led the project, and she will be presenting the report to you this afternoon.
Good afternoon, Madam Chair and members of the board. I'm with the planning and evaluation team with the health unit, and I will be giving you an overview of the final report for the opioids early surveillance system submitted to the Public Health Agency of Canada in 2022. So just a little bit about the background and deliverables. So this was a one-time funding opportunity offered through the Public Health Agency of Canada. All the deliverables for this one-time funding project are now complete. As of March 15, 2022, project funding has been received. For the development and infrastructure of the surveillance system, so over the 2-year project duration from 2020 to 2022, staff developed a surveillance system unique to the Haldimand Norfolk Health Unit, which comprised of a web-based surveillance alert system, a data management tool to gather and synthesize real-time information, and a dashboard hosted on the health unit's website. The reporting survey is accessible on the harm reduction website platform found on using a secure password. Community partners include hospitals, OPP, EMS, and organizations such as the AIDS Network. An early warning alert is issued if the monitoring trends show a higher than usual occurrence of opioid events in the community. An internal alert protocol is launched to communicate the events to staff and stakeholders in the community. An opioids monitoring bulletin board provides quarterly updates to stakeholders about data associated with opioid overdose events. So the outcomes and benefits to the health unit. The opioids early warning surveillance system enhances the health unit's harm reduction efforts in the early identification of risk in opioid overdose events in our communities. Through the surveillance system, the health unit is able to promote ongoing collection, analysis, and interpretation of substance use data for harm reduction programs and services. Opioid overdose signals are received in real time on a centralized reporting platform. It will facilitate better communication and information dissemination to staff, stakeholders, and the community. The system also supports the provincial government's harm reduction program enhancement requirements in the timely collection of opioids overdose data. Conclusively, with the monitoring surveillance system developed, the health unit has a great opportunity to respond to an overdose spikes in the community in real time. For the public, the opioids overdose data provided through the dashboard will be used to increase awareness about trends and available supports for opioids overdose. I will take any questions at this time.
Thank you very much for your presentation. Questions, Board Member Huff.
Thank you, Chair Martin. Thank you very much for your report. I appreciate it. I guess my question is, and I understand that this was grant money that came in, but it's a little alarming to me that in a community our size, that it took us $80,000 to establish a dashboard in terms of the real-time reporting of opioid deaths and increase in our increased deaths in our community. And this didn't even provide any actual harm reduction. This 80,000 was strictly for the use of the dashboard. And is that correct? And the other question I have is, how was this information gathered prior to this dashboard being established?
Okay, through the chair to the member, I will let my manager answer this question.
Okay, through the chair to the board member. The funding was mainly used. The funding was mainly used for staff remuneration. We did present a report on the use of the funds, that we used it to fund the remuneration for Miss Faiza Siddiqui to carry out the project, and that was mainly what the funds were used for. We did also have some stakeholder meetings, a couple of stakeholder meetings, which some of the funds were used for. We also paid for the enterprise, the surveillance platform. That's the SurveyMonkey enterprise, which was hosted by the IT department. So that part of the funding was used for that. In terms of, can you please repeat the second question if you don't mind? I apologize.
Yeah, no problem. My question was, how was this information among the stakeholders shared prior to this dashboard being implemented?
So prior to the dashboard being implemented, we actually didn't have data coming in on real-time events in the community. We relied heavily on the provincial data, which would come in, which we were dealing with retrospectively. So we would look at our data from the previous years. We never really had data coming in real time. So this platform then provides us with the opportunity to know what the events going on in the community real time.
Okay, thank you very much for that. And I guess my follow-up question would be, in regards to actually applying this to harm reduction, how does it benefit our community in terms of actual hands-on harm reduction, the dashboard?
So thank you through Madam Chair to the board member. The information the information comes into the health unit as the staff. We have our epidemiologist and our analysts who go over the data and see if there's a trigger. If there's a trigger on the threshold, if the threshold of the events is sorry, I'll start again. Once we hit the threshold for events, real-time data, once we get that threshold, then we have a stakeholders meeting. We have our core group, our community members, and we have a meeting to discuss the response that we have received, and we discuss implementation methods or response methods to deal with the threshold that we get in the community. And so this would help us to implement programs or develop programs that would help to address the issues that we're having. So for instance, we have a trigger that we've had more than 10 deaths in a week, as an example. We call an emergency meeting with our core partners, and we discuss ways in which we can intervene. Most of the time we have our community partners, such as the AIDS network, who advise us on things that we can implement immediately within the community. So it could be things like a community meeting with, they are more in the community than we are as a health unit. And so they are able to provide more advice on how we can respond to.
Oh, we lost you there. You just got muted for that last little second there.
I'm sorry, can you hear me now?
Perfect.
Sorry about that. I unmuted myself by mistake. So once we have the community meeting and our partners advise us on, we discuss together how we can respond to these events in the community, then we implement those advice that will coming. So it could be a mass campaign to alert the community members of whatever is going on, and we also are able to promote the services such as our naloxone program that is available to prevent overdose events in the community.
All right. Thank you very much for all that information. It was greatly appreciated.
Thank you.
Mr. Shaw, did you want to chime in on something or?
To you, Madam Chair, I'm good. I think he responded well. Thank you.
Okay, thanks. Board Member Van Andriesch?
Yes, thank you, Madam Chair, through you. So to understand this better, a dashboard is a system of when an incident occurs, the incident then is reported onto the dashboard, each incident. So does it tell us things like how many incidents occur a day in a location, and are those triggers to say, if say the police officers are in town and they say this is an area that's being heavily used, that they would make a more of a trip around that area to identify if there's anyone in harm's way that they could assist? Or how does it actually work? Is it just information that gets downloaded and then you react after it hits a threshold? Or does this give us some data that the OPP can use, or groups in towns and everything help people to find locations and that? Like, I'm not sure that I think that I know that the dashboard is doing its job.
Through the chair, the member, I just wanted to say, so the dashboard, so how information is collected, there's two different streams of data. So we're collecting data from the hospitals, and we're also collecting data related to events that are occurring in the community. And we want to understand a true picture of what's happening in the communities, because usually those events are unreported. And the police are part of our collaborative. And this project is, the key pieces, the components have been developed. And I hope you can understand that it was developed during the pandemic. So we are still in the process of fine-tuning and strengthening the system in itself. So if you look at it, so if when a threshold is reached, so we have reports from the community, within the period of 24 hours, say there's 10 cases, the location is established. So we work with our core advisory group. So once a trigger is established, we work with our core advisory group, we have guidelines, and then we work together to, for example, verify the data to make sure that it's accurate, and the location as well. And then from there, we hope in the future that we can work collectively with our harm reduction action partners, which involves EMS, the police services, to create a response, to create an action response. So the funding that we received here, actually, there's different municipalities also working on this, fine-tuning it. It's a new system, so it does work. And also internationally, in the States, it's also been implemented. They have surveillance systems. So it's very new. We're in the process of fine-tuning and working on it. And we hope to increase our capacity, working with stakeholders, developing partnerships, there's more reporting sources to make this the system work better.
So when you're telling me that, I get the impression that these naloxone kits, if you find that it's in a prevalent location, that you're going to maybe find a way of having someone else assist, so that you have more areas of support. Because if you get a call, EMS will turn up, or police will turn up, and everybody's carrying the naloxone kit. But if you find more data that it's occurring somewhere where they can't get to as quickly, maybe you might find a community group that can assist in that. Would that be logical as well?
Yes.
Because
So
if you know where the number of areas are high trafficked areas, then you'd say, let's get some help there as quickly as we can. So maybe if it's, and I'm just, talking here. I don't know if it occurs. But if it occurs in a certain area or at a church or something, then someone knows how to use the kit or has kits available to use.
So through the chair, so the system that we have is designed to exactly do that. Once we create a response system, and our public health nurses do provide training to community organizations, we hope to strengthen that as well. Have partnerships, relationships with pharmacies, so that we can train more community partners in offering naloxone. And like you said, the response. So if we know through the system something's occurring, we can alert our community partners, and that's what it helps us identify. But to get there, it will take time.
I think it's fantastic because the data that you're gathering will assist those in need. And I appreciate it. It's
Yes.
great.
Any further questions from board members? Seeing no hands, I'm looking for a mover or seconder to move the staff recommendation or propose an alternative. Staff recommendation moved by board member Huffman, seconded by board member Michelle. All those in favor? It's carried. Thank you very much for your presentation.
You're welcome.
Bylaws, we have no bylaws, we have no motions. Notice of motions. Does any board member wish to introduce a notice of motion? Seeing none, what about other business? None, great. Okay, we have one closed session item. I'm looking for a mover and a seconder that committee enter into closed session at 2:29 p.m. to discuss HSS 23C01 Medical Officer of Health vacancy pursuant to Section 239(2) of the Municipal Act 2001 as amended, as the subject matter pertains to personal matters about an identifiable individual, including municipal or local board employees, and labor relations or employee negotiations. Moved by board member Breton, seconded by board member Duffy. All in favor? Carried. Okay, welcome back, everyone. We have nothing to report other than direction was provided in closed session. I'm looking for a motion to reconvene in open at 3:06 PM, moved by board member Van Andrieschi, seconded by board member Duthie. All in favor? Carried. So staff was provided direction on the staff report. No further action is being reported at this time. Confirming bylaw. May I have a motion to approve bylaw 2023-03 BHB, confirm the proceedings of the Board of Health for the Halton Norfolk Health Unit, this regular Board of Health meeting on the 7th day of March 2023, to be signed by the chair and clerk and affixed with the corporate seal. Moved by board member Michele, seconded by board member Huffman. All in favor? Carried. And a motion to adjourn at 3:07 PM. Board member Huffman moved, seconded by board member Louise, Van Passen, and all in favor. That's carried. Thank you. All right, let's jump right back over here to our public hearings committee. Do we need to switch our links or anything online? We're good? Okay. Welcome, everyone, members and guests, to the March 7th, 2023 Public Hearing Committee meeting. I would again like to remind everyone that our meetings are web streamed and televised, and I would ask you to ensure that your phones are on silent. If you're attending virtually, please mute yourself when not speaking. When called upon to speak, please turn your camera on and unmute yourself. For staff in attendance, please use the Microsoft Teams raise hand feature icon to be called upon and remove it after you're finished speaking. With that, I now call the March 7th, 2023 Public Hearing Committee meeting to order, and we're going to go ahead and do roll call. It appears that all members of council are in attendance for this meeting. We have received a late request for a formal presentation in relation to item 4.1, proposed closure and conveyance of McFool Street, unopened, Plan 97B, Waterford, CS 23040. It did not meet the requirements of our procedural bylaw, so we will require council to approve it as a change to the agenda unless any council member wishes to speak against adding it. Councillor Huffman?
Thank you, Mayor Martin. I guess my question is why would we go ahead with something that didn't meet the deadlines? Can I get a clarification as to why we would entertain this? So I guess I'm speaking out against it.
Sure. Tracy, are you able to share?
Thank you through the chair. From what I understand, it was just a timing issue, and it is something that staff can look at through the procedural bylaw just to make sure we can review our timelines to see if this is going to be an issue going forward.
Councillor Van Pass.
Thank you, Madam Mayor. And we discussed this earlier. I talked to Deputy Clerk about this already before the meeting this morning that, we have our procedural bylaw and all that, but there's also meetings that are held under the merit of the Planning Act with provincial legislation, which would overrule ours. This is road closure that again follows provincial legislation. So not sure which one, whether it's our procedural bylaw that trumps the provincial law. I know that can't happen. So I think the clerk's office is going to be looking into that to try to find a way to make it fit both sets of legislation. The timing issues are one thing, but the rules of the game are also very important, that we don't break provincial legislation on open public meetings. Right? So I'd be happy to put a motion looking for 2/3 majority to waive the procedural bylaw to allow the deputation or presentation on this issue, if that suits everybody's, if the needs of the clerk are met by that.
Are you looking for us to waive, or are you just looking for a motion to amend the agenda?
Through you, we can do whichever one council chooses to do. Either one would be fine.
Probably easier to just amend the agenda, but
But let's do, because I didn't do it last time when we allowed sort of a thing around the rules. So let's do it the right way. And I'll put forth a motion that the procedural bylaw be waived to allow for the deputation. But then we need 2/3 majority. If we don't get that, then we have to send the deputation on anyway.
okay. Moved by Councillor Van Passen, seconded by Councillor Columbus. Is there any discussion on this? Not that there really should be, but I suppose the discussion is we need to start setting our agendas properly and getting them published online properly. Okay, with that, I'll call the question. All those in favor? And opposed? And it is carried. Disclosures of pecuniary interest. Are there any today?
We still need to accept the agenda.
Sorry, mover and seconder to accept the agenda as amended. Moved by Councillor Banerjee. She's seconded by Councillor Barry. All those in favor? Carried. Thank you. Okay, cut everyone off there. Are there any declarations of pecuniary interest? No? Okay. I will officially open the public meeting held under the Municipal Act, the Planning Act, and county policies. Please be advised that to preserve your right to appeal the Ontario Land Tribunal, you are required to make a comment or provide written submissions prior to the passage of a bylaw. It's important to note that no final decisions are being made on these matters today. The meetings are to allow the public to provide initial comments, and further reports will come forward at a future date. With that, we'll move into the only agenda item today, 4.1, proposed closure and conveyance of McCool Street unopened, planned 97B, Waterford, CS 23040. And I believe we'll start with Ms. Van Dyke. She can introduce the team.
Thank you, Madam Mayor. Through you to council, we have Kelly Derbyshire and Maria Harrison from our realty team here today. And Ms. Derbyshire is going to present a report.
Thank you, Heidi. Through the chair, report CS 23-040 is being presented to the Public Hearings Committee for information purposes to allow the public an opportunity to express concerns, comments, objections, or support with regards to the application made by G. Douglas Valley Limited, agent for the applicant. The application requests closure and conveyance of the unopened portion of McCool Street in Waterford as part of a proposed plan of condominium. This report is being presented subsequent to the planning application report that was heard at the Public Hearings Committee meeting of February 7th, 2023. The report provides the nature of the request by G. Douglas Valley Limited, along with the additional associated details. Realty staff did not receive any public input from the advertising with regards to the proposed street closure. At the time of the writing of this report, one adjacent property owner had expressed interest in purchasing his respective portion of the road allowance. However, no follow-up communication or application was received by the property owner by the February 27th deadline as indicated in the secondary communication. No response or communication was received whatsoever from the other adjacent property owner, and as stated in the secondary communication, no response received will be taken as an indication that they have no interest in this matter. A further report will be brought back to council for the purposes of a decision. Staff are here today to hear from any members of the public and to answer any questions council members and the public may have related to the requested road closure. In addition, staff from engineering are in attendance today to provide additional comments. And with that, I will turn it over to Mr. King for his comments. Thank you.
Yes, thank you very much. Through the mayor to the members. I don't really have anything to add for that, but like was mentioned, I'm here to answer any questions that may come out of the report.
Okay, thank you, staff.
Thank you.
Questions for staff at this point? Councillor.
Thank you, Mayor Martin. I guess to staff, I just want to be certain that when we're looking at the abutting lands here, and I do understand it looks like due diligence was done and communication went out. A second communication attempt was made. I'm just a little leery that there was some expressed interest, and I just want to make sure that we've dotted all of our I's and crossed our T's in regards to the first and second communication with the landowners who are abutting this property. Just want to be double sure. Through the chair, yes, we did send out 2 communications. In the second communication, we did indicate that if no response or communication was received further to February 27th, that would indicate that they had no interest in this matter going forward. I did follow up by telephone with the one adjacent landowner that was interested, and I did stress that he needed to contact us to let us know either way. Again, no communication was received. What we would usually do is following the public hearing is send out another third letter just to let them know that no communication was received from them and we will be moving forward.
Any further questions to our staff?
Well, these parties that are in close proximity, like the individual here, they were fully aware that they could come to this particular hearing committee meeting.
Through the chair, yes, they were both aware that they could come to the committee meeting. It was advertised in the newspaper, on our website, in the letter, and I did discuss on the telephone with that particular individual that he was more than welcome to attend the meeting today.
No other questions to staff at this point? Okay, Mr. Valley? Oh, sorry, I should check and see. Is there anyone on the line who wishes to speak? Do you have slides you want to put up on the screen?
I'm sorry?
Do you have slides for us?
Yes, we do. That actually was the issue. It was my PowerPoint that was late being submitted to the clerk.
Oh, they're out. Perfect.
Thank you, Mayor and members of council. So what we're here to talk about is this McCool Street opening. Do I have control here or there we go. So this drawing here hopefully clarifies what we're doing a little bit. The heavy green hatch up at the top, right beside the words Cottonwood condominiums, that is the portion of McCool Street that we're proposing to close. It's interesting to note that immediately below that is a large red strip. That is the portion of McCool Street that has already been closed, and that was closed to facilitate the subdivision that you see drawn all around it. So access from McCool Street southerly to connect with anything to the south has already been precluded and terminated by that previous closure and the subdivision. If you could advance one for me there. You may have to click twice, I think, too. There we go. Okay, so McCool Street previously closed. What we're talking about is a dead end of McCool Street, and it has no connection possibility today whatsoever because it abuts against an existing subdivision. So if that subdivision was developed as it was approved, there's no provision within that subdivision for connectivity. So today, as it stands today, there is no connectivity. The only way to have connectivity is to sell the land to the developer, let him assemble the land parcel that he's trying to do. He already owns one parcel. He has an offer to purchase 260 Church Street, which your staff have been involved in, and now to purchase the road. If he can connect all those three parcels together, then he can provide a pathway and a walkway, so you at least have pedestrian access through this site, which would create connectivity. So this is not a situation where closing a road precludes connectivity. And this is a very odd example where closing it, selling it to the developer actually creates the connectivity that we're looking for. If there's no development, if there's no sale, then that blue area that you see on the screen that's hatched blue, just to the left of the top of the red, that blue is already a council approved condominium block, which would be developed because that already is approved, and that would once and for all seal off any extension of that road. So what you have to keep in mind is that through this development, we would create a sidewalk through the development, which you see is a green line, a thin green line right under the words McCool Street, that would connect down to the subdivision and could connect out to the trail as well. So you could have connectivity from West Church Street at the top, down through the condo, into the subdivision and over to the rail trail. We already have the blue lines as connectivity from West Church Street out to the rail trail, down the rail trail, and back into the subdivision at the bottom. And then over on the right-hand side, you see a third blue line, which is existing connectivity from Cottonwood Street down into the subdivision. So within the span of 200 meters from east to west, you'd have three methods of connectivity for pedestrians to walk in a north-south direction. So I think that the key here is there's talk about losing this connection because you're selling the land. In this case, it's actually the other way around. There is no connection today. If you sell the land, it will let the developer create that connection. So I think that's really important. The report talks about a fair market value of $92,000 and change. The developer obviously would support that as a price being the fair market value determined by your appraiser. There was a talk in there about a higher price if there was to be a condo development which would preclude traffic. We find that a little bit odd because that traffic connection is not there today. So it would seem odd to us that we would pay a surcharge, if you will, because we're cutting off road traffic, which is not possible today. The other only comment we have is regard to road widening. And if you could advance the slide one for me, please. On the left, you see a blow up of the north end of the unopened road allowance, and you see the dimension there, 6.1 meters. So staff have asked that we widen the road, that we take off part of this McCool Street that's to be purchased and make that part of the West Church Street road allowance instead of the McCool Street road allowance, so that West Church Street would be full width according to your standards. Presumably that is so that if the road is reconstructed in the future, you'd have your full 20 meters, which is Norfolk County's standard. The challenge is that the rest of West Church Street is not that width. And if I just took a quick look on your GIS system, and the photograph at the top right shows that red line. The left hand of the red line is where we are talking about, and the right hand end of the red line is where West Church Street meets Main Street. For that full length down there, West Church Street is the reduced width of, I think it's around 15, 16 meters. So taking that extra 6 meters for this little piece is only going to be effective reconstructing your road if you're going to do that same widening all the way down that long road all the way to Main Street. So you would need to approach, by my count, about 70 homeowners, knock on their door and say, we want to take 10 feet off the front of your property and expropriate some land to have a road width of that 20 meters. So unless you're willing to go and expropriate land from those 70 homeowners, having that full width at this little piece at the west end is somewhat useless. So we would ask that that widening not be taken, that it's not feasible, and that it really provides no benefit to the county, because we don't think you're going to knock on those 70 doors and expropriate that land. So what we want to do, if you could advance the slide for me, is a simple development. You saw this a few weeks ago. What this facilitates is 30 one-story townhouses. So these are more geared to seniors because they're one floor, they're accessible, they're 1,500 square feet, so they're large, nice units, double car garages. The site plan that we've developed would require 60 parking spaces by your bylaw, but we've designed it for 103. So we have way more parking than what's required by the bylaw. There would be a sidewalk through the development that people could walk from West Church Street down to the subdivision down below. I think when we get to the decision meeting on planning, you're going to find that this development meets all the requirements of your official plan as far as infilling and so on and so on. So it's a great development, a great way to utilize this piece of land. And that's about all we have to say. So all we're asking of council is that you approve the closure, the $92,000 as per your appraisal. We find acceptable. We think that's fair. And we would ask that there be no road widening up at the top end. I'm here for any questions you might have.
Perfect. Questions for Mr. Valley? Councilor Breton.
Thank you, Madam Mayor. Just very quickly, to John. John, what's the condition of that road that you talked that if we were to widen it? Sorry, is that Church Street?
West Church Street up at the top, yes.
Yeah, where is that? I'm not that familiar with it. Is it a newer road or an older road or what is it?
It's Councillor Huffman probably answer that better than I can, but I think it's an older road. I'm not sure. I think it could be tar and chip. I don't think there's curb and gutter. So it would be at some stage a candidate for reconstruction, but the full length of it is 15, 16 meters wide, something like that. It's definitely less than the 20.
Okay, thank you.
Okay.
Yes, it's a very, it's an original road there in Waterford Township, and he is correct, no curbs and gutters, and it is extremely narrow, and it is due for, reconstruction. Immediately, I don't think it's on this year's budget or anything, but it's definitely one of the ones that needs to get done.
Any other questions to Mr. Valley? Okay.
Thank you very much.
Would I be able to put some of our planning staff on the spot here? I see that you're here in attendance. Sorry, but I'm just wondering about your comments. I know it's a realty services file, and we're not going to talk about the development, but I guess I just wonder through also the community services division, or doing our land monetization plan. This is a parcel in isolation of that. Through the connectivity of this parcel to others, like, do you have any comments you want us to be aware of? It's okay if you don't.
Through the chair, sure, we can provide a few comments. So typically in an area like this, we see as an area in transition is probably the best way to call it, that it was formerly designated zoned industrial, now it's transitioning to residential development. I know Tricia was working with, I think, a university group to look at some possible, used to call it block planning for the area where we have multiple parcels like this. We don't have anything in place. There's no secondary plan or detailed plan for Waterford right now. Some key things to look at when looking at possible road closures or redevelopments here would be connectivity. So we're talking about transportation for roads. We're talking about pedestrian mobility, and then connectivity, I'd say, for services. And so at this point in time, I think from our perspective, it's not too critical to have road connectivity right here anymore. There's other options. And also, as was explained earlier, the one section of the right-of-way was already closed to the south. So the connectivity part would really only be to connect to Cottonwood. Is the only option that's left. And if that's not necessarily needed from a traffic distribution standpoint, then it's not too critical, I think, for a public street. Pedestrian, the key things would be to make sure there's at least pedestrian access from these developments towards the trail and to get to any other key destinations. And if there's still pedestrian access assured. And then it's servicing connections. Do we need any looping or connections through this area that might need that right of way? So I defer to our E&IS folks on that if that's not needed. But it's, I would say, probably pretty important for the redevelopment of the parcel adjacent to it on the east to have this portion or all of the municipal right-of-way. So that's probably pretty critical for the redevelopment of that area, and the municipality may want to think about the value in that and how this might facilitate development and what some of our municipal objectives are.
That's a good point. I should have asked this of Mr. Valley before I switched over to you. We have a parcel of land that your client would like that is not a part of our land monetization strategy. And you're working on a proposal for 30 townhouses. Is there any wiggle room with your client to negotiate a percentage of affordable units, a percentage of units with a finished basement and a separate entrance, and a portion of units that are environmentally friendly? Net zero. Sure, please. I apologize. I should have asked that to you first. Because I say this because obviously the parcel doesn't do Norfolk County any good. But we do have a land monetization strategy that we probably should be putting all of our parcels in and going out on an equitable basis. I understand that the public was consulted on it, but if we were to put together a big plan with all of our parcels, would it have been a different outcome if it was marketed accordingly and so on? That ship has sailed. But do you think that there's any interest from your client to?
I think there is interest from our client. This is a partnership between a few different individuals here as client, and they're experienced developers. So, I think they would be willing to talk with you, especially you mentioned, secondary dwellings, that kind of thing. That can be a little bit of a challenge in townhouses, especially on the interior units because of building code requirements. but we certainly have lots of parking on the site, so that kind of thing could be accommodated in the, especially in the end units. I believe if I look at the plan off my memory that these are blocks of 4 units, which would mean you could get up to 50% of the houses with secondary dwelling unit in them. So yeah, those kinds of things are all potentials. And of course, that is all details to be worked out at site plan and building permit stage, of course. But there is room for discussion on that, absolutely.
I know that it's hard for us to say affordable and then have that transfer over in dollars and cents to the public. I know there's a cost of building and adding more supplies into a unit when you create the secondary dwelling, but I guess the concept is you're creating a unit that goes on the market that now a first-time home buyer can immediately collect rent to subsidize their mortgage if that basement is finished, if it has a separate entrance. And so maybe that's a way that we're able to chip away at housing stock and creating more affordable units, not affordable units. But I'd be very interested in that. I think it's worthwhile for the municipality to work with you and your client on this parcel of land, but how can we offset land that we have and meet the mandate? This morning we worked on our strat plan and we talked about some of our goals, and affordable housing kept coming up, but the question was, why do we keep talking about it if it's not something that we can meet and is measurable? So we really need to start checking the box on some of it. So maybe I could ask staff, what would your suggestion be if Mr. Valley's saying he's open to a conversation with his clients? We might be able to negotiate. That would come in site plan. So we don't want to commit one way or another until we.
Through the chair, I'll defer to others, but I think the county may want to consider that in any agreement of purchase and sale without certain conditions or through that negotiation, which would be kind of outside the planning process. I'd say it's more of a county land disposition agreement process. That might be the appropriate place to put those negotiations in and what it might be.
Okay, and it's just a public hearing today, so we don't need to give that direction, right? But staff, you can hear kind of where we're going, and you can hear that I don't hear any objection today as to not selling the land and not moving forward for Mr. Valley and the client, but I'd be interested to see what your client would be able to put on the table for us and be able to work with us, given that we're looking at this one piece of land in isolation from our land monetization. And I guess we'll wait for the entire proposal to come back to us.
So just so I'm clear, are you looking for the developer to submit something else before this matter comes to the decision meeting, or what?
I would be interested to see, yeah, what your developer would be interested to do with their parcel prior to us signing off on the land deal. I'm not hearing any objections here today to the land deal, but I do think that we should be careful with our county land and giving it, selling it in isolation from our land monetization plan, and we should be giving consideration to our goals that we just sat around the table and discussed this morning. So if you're able to have that conversation and then bring it back to staff conjointly, then maybe that's something we'll work into the language on the land deal and agree to what your client has put forward.
Very good.
Okay, thank you.
Thank
I
you.
appreciate that. Any further comments from any council members? No. Okay, that's great. One final call for anyone on the line who wishes to speak. Okay, I'm not seeing anyone. There's no one else here in council chambers. There's no one on the line. So does someone wish to move the staff recommendation or propose an alternative? Moved by Councillor Huffman, seconded by Councillor Duffy. All those in favor? That's carried. I'm looking for a motion to adjourn at 3:35 p.m. Moved by Councillor Huffman, seconded by Councillor Berry. All in favor? Carried. Thank you very much.